Air pollution resulting from controlled burning near Sydney was so severe it probably caused 14 premature deaths and may have sent dozens of people to hospital, according to a new health study. The research, published in the Medical Journal of Australia, used statistical models to identify baseline deaths and cardiovascular and respiratory hospitalisation rates. It found about a 5% increase during a 6-day period last autumn of high pollution over the city. It was one of the worst events in Sydney's history, comparable with the pollution from major bushfires, said Fay Johnston, head of the Environment and Health Research Group at the University of Tasmania. Conditions were perfect for hazard reduction burns, and there were many burns. The most dangerous form of pollution involves particles of 2.5 microns or smaller. Such particulates, roughly 1/6 the width of a human hair, can enter the lungs or bloodstream and damage the health of the young, the old or those with chronic conditions. During the worst days of the smoke haze, some parts of Sydney were averaging more than 6 times the level considered safe, sending an additional 101 people to the hospital. With the ideal conditions, many small fires were lit by the Rural Fire Service around Sydney, with much of the smoke settling in the basin. They've got targets to reach and they carried on burning despite that smoke. And that's when it really built up, Dr. Johnston said. The extreme episode should prompt authorities to give greater scope for smoke in their modeling and encourage better warning approaches to minimize the risk for vulnerable members of the community.